I'm a radiation oncologist that is a subspecialist in brachytherapy. And brachytherapy is a very important subspecialty of radiation oncology. And in brachytherapy, we use radioisotopes and apply them into the human body to treat cancer. We use some scientific developments that have happened in my lifetime since between the time I started medical school and now. Important developments in imaging of the body, CT and MRI, important developments in ultrasound imaging and the application of the placement of needles or applicators into the body, and then powerful computing to very accurately deliver radiation into a tumor or a tissue that is contaminated by cancer. And by so doing, we can deliver a very high dose locally and have a profound impact upon the cancer and a much less impact upon the tissue around it. And so that's my subspecialty. I recognized early on in my training that part of radiation oncology needed a lot of development, and I've dedicated my career to that aspect of radiation oncology. And I feel very comfortable sitting down with a patient and listening and focusing on that patient's concerns and problems. I have a little bit of ADD in me, which means that I can hyper-focus and I can ignore everything else and focus on what the problem is. So my average patient is a male with prostate cancer, and they often range in age from early 50s to early 80s. They've worked hard for a long period of time. Many of them are almost ready to retire, and now they confront the diagnosis of prostate cancer. Traditionally, the treatments for prostate cancer have caused a lot of men morbidity, have altered their lives, taken away aspects of their life that are very important. And many men, decades past, have suffered greatly as a consequence of prostate cancer and the treatment of prostate cancer. In this day and age, we can use important developments in science and apply them together and deliver treatments that are highly effective with a high efficiency to cure patients and also to maintain quality of life. And so I feel like in our day and age, a man who is diagnosed with prostate cancer doesn't need to lose a livelihood, doesn't need to lose a quality of life, doesn't need to take a long period of time out of his life to have his cancer treated. And that never before have we had such good outcomes from the application of scientific knowledge as in our current treatment of prostate cancer. How do I handle stress? Well, I do have stress, and take a deep breath and relax my body and my hands and tell myself that I am stronger than the challenge at hand. I love to be out in nature. My wife and I are avid hikers. I'm a bicycle commuter. I find that is actually a relaxing time in my life. Just riding my bike to and from work. I got 2 degrees at BYU. I got a Bachelor of Science degree in chemistry, and then I got a Master of Science degree in physical chemistry at BYU. 4 years in medical school at the U, and then 5 years in residency training, and then 5 years on the faculty. I live right by the University of Utah. I'd have to probably say that there is a little bit of red in me, but I definitely find that there's still a lot of blue. So we've been doing HDR brachytherapy here in Utah for prostate cancer for 18 years. A great team here who are using the latest in technology to try and make it so that you can live a normal life after the treatment of your cancer.
Gamma West, taking cancer personally.